Hello everyone and welcome back to my playlist of 10 Teachers Gynaecology. My name is Professor Asif Qureshi and you are watching Dr. Asif Lectures. Today we are going to talk about chapter number 9 from 10 Teachers Gynae, and the name of the chapter is Genitourinary Problems. Okay, and the learning objectives, as we always do in the beginning of 10 Teachers chapter, for this chapter the learning objectives will be to understand the importance of sexually transmitted infections in gynecology, very important topic. Describe the testing, the diagnosis, transmission of common STIs and bloodborne viruses. Understand that support is needed for patients to enable them to undertake the screening. Appreciate that human immune deficiency virus has changed from life-limiting to a chronic manageable condition. It's a very important point. Once there was a time it was a life-threatening and fatal disorder, but now with optimal care, it is a manageable condition. I mean, this is true for a lot of medical conditions. And this is what talks about the success of medicine. I mean, think about malaria when it was first reported and, initially, we used to see a lot of people die from malaria, but now this is absolutely manageable. And there are so many other examples, HIV being one of them. It is no more fatal if treated appropriately. Learn how to take sexual history. This is a sensitive area. और मैंने जब हमने history का chapter किया था, तो I emphasized upon this quite a lot. We should be able to understand the diagnosis and the screening of HIV and describe the care for HIV positive mother as well as the baby. Because here you are dealing with gynae topics, right? So you're talking about a pregnant female, and the pregnant female is not one individual, it is two individuals. And therefore you have to take care of the mom as well as the child in terms of HIV positive mothers. Because HIV, I mean, we will talk about vertical transmission and how to control that. Okay, so these are the learning objectives for this chapter. Let's talk about the introductory paragraph. And understanding of the sexually transmitted infection. इसको किसी ज़माने में STDs भी कहते थे, अभी भी कहते हैं. बाज़ books में you will find this terminology, sexually transmitted diseases or sexually transmitted infections and their complications. It is crucially important in gynecological practice, this because you see them quite a lot, and it's very important to manage them because they have direct implication on pregnancy outcome, gynecological health, even obstetric health. The subject is frequently misunderstood, and the impact on affected women, their partners, and at times their children may be considerable. So this topic that we are going to discuss today is not only affecting the patient. I mean, that's an important thing. So if the female has STI, it's not only the female who is vulnerable to the complications, but also the partner, because they will have sexual activity, they will have intimacy, they will have intercourse. So this infection can be transferred to the partner. And similarly, if she is pregnant, the infection can also be vertically transmitted to the baby. So there are three lives being affected: the patient herself, the partner, as well as the upcoming baby. Okay, so that then makes the topic even more important. STIs are often asymptomatic. Usually they do not have any particular symptoms, but still they can be transmitted even in the asymptomatic phase. They can be transmitted to the others, and they can cause significant problems, right? For example, human papillomavirus infection and cervical cancers, you know the strong association. STIs disproportionately affect younger people because they are sexually active, but increasingly they are identified in older people in whom the diagnosis is often not considered and so can be missed very easily. ऐसा नहीं है कि सिर्फ जो लोग sexually active हैं, they will only have the STIs. I mean, older people do have it. In fact, they have it more, and it is usually misdiagnosed. STIs often coexist, and when one is found, screening for the others is required. So अभी हम पढ़ेंगे चैप्टर में आगे, there is a group of disorders जिनको हम सब मिला के ये नाम देते हैं STIs. So they coexist. अगर एक infection है तो दूसरे के होने के भी chances हैं. So you screen for all of them. Tests for STIs have hugely improved in recent years with the advent of highly sensitive and accurate molecular testing also available. So, for example, Syphilis के लिए, we can now do very sophisticated, and for other sexually transmitted infection, we can do very sophisticated type of molecular diagnostics. Women often diagnosed first when they have young families and they attend the reproductive health care and are offered screening. They require support to inform present, previous partners. I mean, consent and ethical सारी चीजें आपने cover करनी है, obviously. This aspect is of managing STIs can be very challenging, but it is crucially important, the partner thing. The consultation may lead to consideration of safeguarding of women and girls who may be exposed to sexual or domestic violence, abuse, coercion. So see how sensitive the topic becomes when these terminologies are involved. ट्रीटमेंट एंड मैनेजमेंट ऑफ HIV इन्फेक्शन हैज बीन ट्रांसफॉर्म्ड, ये एक बॉटम लाइन है, इसीलिए इसको अलग से एक पूरा पैराग्राफ दिया है. अगेन द सेम पॉइंट के once it used to be a deadly, life-threatening, fatal condition, but now this is becoming more sort of a manageable condition. Okay, and with the passage of time, treatments are becoming better, less toxic, available easily, cheaper, generic medicine. So the HIV treatment is actually improving by leaps and bounds. Unfortunately, STIs and HIV remain a stigmatizing condition for any woman. So if any woman is diagnosed with STI or HIV, they may, or the society may think that's a stigma. However, you need to be, as a physician, you need to be playing your role to ethically and sensitively approach this case. Taking a sexual history, this is the first step to identify and treating STI, and taking sexual history is very sensitive, very delicate, very important topic, right? It allows the healthcare professional to quantify the risk and decide what are the chances. For example, there's a single partner or multiple partners, or those multiple partners regular partners, or they are random partners. So history taking becomes very, very important in identifying the risk of sexually transmitted infection. Raising the issues of STI may be unexpected, and it is important to start by ensuring privacy and then explaining why the subject is being broached. ये हम टॉपिक क्यों डिस्कस करें, उनको बताना पड़ेगा, बात करनी पड़ेगी, प्राइवेसी इंपॉर्टेंट है, एथिक्स का आपने ख्याल रखना है, ये सारी चीज़ें. यू हैव टू मेक योर पेशेंट कंफर्टेबल. ओके, मैं हमेशा बात कहता हूँ, और जब मैं हिस्ट्री टेकिंग पढ़ा रहा था आपको चैप्टर नंबर 2 में, तो तब भी मैंने ये बात की थी कि यू हैव टू मेक योर पेशेंट कंफर्टेबल. ओके, व्हाट आर द इंपॉर्टेंट पॉइंट्स वेयर यू हैव टू कंसीडर कि जी आपने सेक्सुअल हिस्ट्री को इन पॉइंट्स पे लाजमी कवर करना है. सो असेसमेंट ऑफ क्लिनिकल नीड इन सिम्टम्स, व्हाई द पेशेंट इज अटेंडिंग, if symptoms are present, explore their specific features, any history of the past, any past STI history or current status known. So start exploring different aspects. Sexual and other exposures to guide the testing decisions. You need to talk about sexual exposure. How many partners in the last 3 months? Were any protective measures such as condoms, were they used or not? So things like that are very important in identifying the risk assessment and risk stratification for STIs. Contraception needs and pregnancy risk assessment. So last menstrual period कब था, any current pregnancy which is ongoing, previous कोई known pregnancy related diagnosis या कोई risk which were identified previously. So pregnancy related questions are very important. Other sexual health needs, what is the status of cervical cytology, HPV vaccination, ये history का part लाजमी होना चाहिए. Assessment and assessment of risk behaviors open to health promotion. Alcohol, smoking, these are all very important when you are considering a patient to take the discussion in the direction of STIs. Exploitation, violence, abuse, this is very, very important. Also very, very sensitive area. You have to be very careful touching these areas, right? For younger people and all under the age of 16, what is the age of their sex partner? Do they receive presents for any sexual activity? So are they being exploited? Things like that, Okay. Now, testing for STIs and associated conditions. Technological advances have facilitated accurate, non-invasive testing for sexually transmitted infection. Point-of-care testing are available for many infections, including HIV. So this is the good news. You get the result there and then. And now we'll talk about some particulars, right? So bacterial vaginosis, it is perhaps the most common cause of abnormal vaginal discharge. So if some female is coming to you with complaint of vaginal discharge, the most common cause is bacterial vaginosis. Okay, it has been reported in 5 to 50% of the female cohorts worldwide. While a definitive cause is actually not determined, depletion of the lactobacilli dominant in healthy vaginal flora is observed. So this is usually present in because they then produce the acidic environment. If they are missing for one reason or the other, this is perhaps the most common cause for growing of other bacteria. Okay. The existence of vaginal epithelium biofilm consisting of Gardnerella vaginalis and other species has been more recently described. Other risk factors include douching, black race, smoking, having new sexual partners, oral sex, and all these things are risk factors. Symptoms include offensive fish-like discharge, fishy order होती है इसकी. So fishy odor, fishy discharge, that is the symptom that the female complains of. And then the diagnosis is made by evaluating the gram stain, which is the mainstay. Start हम ऐसे ही लेते हैं जब bacterial approach होती है हमारी. Vaginal discharge का you do the gram stain by a validated method, and then you do other things as well. So for example, you look for clue cells, you check the pH, and the fishy odor is there. The female will complain of that. When 10% potassium hydroxide is added to the sample of the discharge, so you can enhance this fishy odor to investigate in the laboratory as well by adding potassium hydroxide. Bacterial vaginosis is associated with a number of pathologies, including PID, pelvic inflammatory disease, which is a broader spectrum involving other pelvic structures as well. Post hysterectomy, vaginal cuff cellulitis in pregnancy, in preterm birth. So there are so many conditions. Increased risk of HIV acquisition is also observed who have vaginosis, bacterial vaginosis. They are increased risk of getting HIV as well. Oral and intravaginal treatments with Metro and Candida are indicated in these women, and that's a simple diagnosis. So female coming to you with vaginal discharge, bad odor, fishy odor, you do all these analysis and you reach to the diagnosis. You treat either with Metro or Candida. Okay, so this was bacterial vaginosis, microscopy and vaginal discharge, and not required if asymptomatic. Treatment is not required if asymptomatic. Okay, all right. Not treatment. Test is not required if asymptomatic. Right. Well, but obviously, if the patient is coming to you with some complaint, then she is disturbed with some symptoms, at least discharge or bad odor, and you would do then the diagnostics. Okay. So this is one thing here in this diagram they're trying to show you. I don't expect they ask you this in exam. So A is the normal lactobacilli. If you look at this diagram, this is how the vaginal flora looks like. These are normal vaginal flora. These are good bacteria for vagina. These are producing acids. And then there can be candidiasis. अभी मैं बताता हूँ क्योंकि हमने पढ़ा नहीं है. But C we have done bacterial vaginosis. So let's have a look here. Bacterial vaginosis. What you see here is an overgrowth of anaerobic organisms, including Gardnerella, and decrease in the number of lactobacilli. You can clearly see जो ये lactobacilli यहाँ populist थे, gram positive, they are lost here. यहाँ पे नहीं है. Okay. Now, what is vulvovaginal candidiasis? Obviously, is the growth of Candida species. It's a yeast, and most frequently, which species it is? It is Candida albicans, which causes vulva में भी infection है, and vagina में भी. The vagina is colonized with Candida species in up to 20% of women in their reproductive years anyway. So that's part of the normal flora anyway. But it may raise up to 40% during pregnancy, and most of the time this is asymptomatic. जब symptoms होते हैं, they are usually fungal infection के जो symptoms होते हैं, itching, irritation, typically white discharge, which is curdy white discharge, yogurt-like, right? On examination, signs of inflammation will be there, erythema, some white patches, vulva or vagina में, together may be white discharge. Symptoms may be more frequent and present when women is diabetic. So diabetics are more prone to getting fungal infection in general, and also for vulvovaginal candidiasis. If they are immunocompromised, if they are pregnant, these are all the risk factors to increase the chances of vulvovaginal candidiasis. The diagnosis is made by taking a bacterial swab. For microscopy, you take the swab and you see under the microscope, and then we can go here and look at the image of candidiasis. You see these, hyphae type structures and growth in colonies and loss of lactobacilli. And this is not an STI, and partners without system do not require treatment. This is an important part to understand. Unlike other STIs, where the partner will also require treatment, perhaps candidiasis partners do not. Trichomoniasis, vaginal and urethral infections with flagellate protozoans. It's a protozoan condition now. We talked about a bacterial condition. bacterial vaginosis. We talked about a fungal condition, which is candidiasis, and now we're talking about a protozoan condition, and in this case it's trichomonas vaginalis. It results in vaginal discharge and variable appearance and symptoms, involves vulva and vagina. Asymptomatic infection is observed in about 50% of the females, and vaginalis, Trichomonas vaginalis, is sexually transmitted, and treatment of the partner is also required if they have been sexually active recently. There is some evidence of an association with pregnancy outcome, preterm birth. So that is serious. If this is there, preterm birth, low birth weight, maternal postpartum sepsis. So these are all the known complications. Testing is indicated in symptomatic women with and the gold standard is the nucleic acid amplification test, also called NAT. It's a molecular profiling where you amplify the nucleic acid and see if this particular bug is there, right? Some NAT tests also detect Neisseria gonorrhea and Chlamydia trachomatis on the samples of these. Optimal test is vulvo-vaginal slab microscopy and culture, and there is POCT, point of care testing, also available, and you treat with Metro, okay, just like you did for bacterial vaginosis. Now, getting a bigger domain, which is involvement of the cervix and PID. So, up till now, we have been talking about the vaginal structure and the vulva, which are the, the first points of entry. But now if you go deeper, you start with cervix and the other structures. So, let's talk about cervicitis and PID. So, let us talk about gonorrhea first. This condition is caused by infection of a bacteria, which is known as Neisseria gonorrhea. As the name indicates, gonorrhea, Neisseria gonorrhhea. Infection occurs through sexual contact, and simultaneous treatment of current and recent sexual partner is required. So whichever infection fits perfectly in the definition of STI, which is a sexually transmitted infection, always consider treating the partner as well. Endocervical infection is asymptomatic in up to 50% of the patients with altered vaginal discharge and most common symptom and lower abdominal pain. तकरीबन only 25% females में. So even if it's there involving the cervix, they are usually in 50% of the patient, they are asymptomatic. Rectal infection occurs through transmucosal spread. This is an important point, okay? This is an STI involving also the rectum. But then obviously there are people who receive anal sex, so unme bhi there is like you put the penis during intercourse in vagina, also put that in anus, and there is a cross contamination. Or if the male partner is already infected, putting directly into the anus, and this is because of anal sex, direct inoculation of the anal apparatus, okay? Even the pharyngeal infection, I mean, obviously those doing orals are also prone to get Neisseria infection in the pharyngeal apparatus because of the reason you can easily perceive. The later is nearly always asymptomatic, which means the pharyngeal thing, okay? Examination is often normal, although cervicitis with or without mucopurulent discharge may be seen. Ascending infection may result in PID, that's more serious. Yani it will now involve the internal genitalia, including uterus, fallopian tubes, becoming a pelvic inflammatory disease. However, very rarely this infection can also spread hematogenously, and it can cause DIC, which is disseminated gonococcal. Oh, not DIC, sorry. DIC is the disseminated intravascular coagulation. In fact, this infection, disseminated gonococcal infection, can lead to septicemia and DIC later on. And it can also involve joints. So, this is the first infection that we are talking about in this chapter, which has the potential to spread throughout the body. अब तक हम जो बात कर रहे थे bacterial vaginosis and all those chlamydia, they were restricted to the largely to the external genitalia and then vagina. But gonorrhea has the capacity to ascend from vagina to cervix to uterus to there and to the blood and to the bones, everywhere in the body. Even ophthalmic infection have been known, but that is particularly when the neonate baby is being born and the canal is infected with gonorrhea. So ocular infection, eye infections become important. So this bug gets inoculated, and hence there is infection in the eye. Okay, right. Let's move on forward. This is the gram stained smear of cervical secretions, and they are highly suggestive of these, bugs, which are gram negative gonorrhea bugs. Testing is indicated in symptomatic women, those who have symptoms, and those who have another STI. So if you diagnose them with some other STI, मैंने शुरू में भी ये बात बताई थी, it's like endocrine problem. If you have one endocrine problem, there are chances there will be another endocrine problem. So STIs are also like that. If there's one STI, there are chances there may be another STI. So if you are suspecting something else and you are investigating for something else, also consider investigating gonorrhea. Okay. So if it is identified, it is important to obtain a sample for culture and sensitivity testing, because you will be initially beginning with the broad spectrum antibiotics, but then you have to curtail it down to whatever the culture and sensitivity reports show to you. A screening of other STIs is also important, particularly for Chlamydia trachomatis, as dual infections are very common. Okay, that's a rule. इसको rule बना लें कि if you find one infection, you check for the other as well. And the other infection that we need to discuss, before discussing what would be the treatment, we talked about the symptoms, we talked about how would it present, we talked about how would you investigate it. Gram stain is very much diagnostic. You can also do moleculars, but this is a cheap diagnosis, very sensitive. How do you treat it? Usually you go with a third generation cephalosporin, you may add azithro, and that's a very successful treatment for gonorrhea. Then chlamydia. Chlamydial infection is the most common bacterial STI with women under the age of 25, and most frequently affected age group yahi hai, below 25. Infection with Chlamydia trachomatis is often asymptomatic but can still result in subclinical pelvic inflammatory disease. Now, you use this word very frequently in this chapter because many of the STIs are actually initially asymptomatic, right? So, ये आपको पता होना चाहिए. And this becomes very important clinically also. For this reason, screening programs for this age group have been developed, and there is some evidence that they reduce the rate of PID. So rather than waiting for the symptoms to appear, you do the screening yourself. Testing is also indicated in women with other risk factors, including new sexual partners and postcoital bleed, intramenstrual bleed, vaginal discharge. You investigate all these females. Examination is often normal, but cervicitis may be seen, mucopurulent discharge may be seen. Infection at other mucosal sites occur in gonorrhea. So this is common, such as conjunctivitis, cervical infection. But conjunctivitis की जब बात आती है, तो obviously it is for the baby who is passing through a canal. The canal is infected with chlamydia, and the baby's eye will catch up this infection. Reactive arthritis is typically monoarticular, so even this can spread to the body and lead to arthritis, just like we talked about gonorrhea. NAT test, which is nucleic acid amplification test, is also available for, and how do you treat this is it's a combination regime most of the times. Azithro or doxy or a combination of these drugs are usually very effective. This then takes me to the next word, which is PID, pelvic inflammatory disease. This is not only a broader disease, but it also affects the patient long term, because this, if not treated appropriately, may lead to fibrosis in the pelvic and peritoneal structures. And this fibrosis, if it is happening, for example, around the fallopian tube, it may lead to ectopic pregnancy or subfertility. So this disease becomes very important क्योंकि इसकी जो complications हैं, these complications have implications. Okay, this occur when there is ascending infection from the cervix. So या तो gonorrhea ascend कर गया, या chlamydia ascend कर गया, और बहुत सारे structures को involve कर लिया. So chlamydia, for example, gonorrhea, अगर दोनों में से पूछें तो chlamydia more common, but they're often not isolated. And other implicated organisms are also there, such as Mycoplasma genitalium, also important, right? The diagnosis of PID is usually made clinically because there are symptoms, pain, fever, dyspareunia, abdominal pain, and intermenstrual bleed, postcoital bleed. These are there. Systemic symptoms of infection may be present, which is fever, pain, lethargy. Characteristic clinical findings include lower abdominal pain and cervical motion tenderness. This is kind of very much diagnostic that there is an inflammation going on. testing for all the STIs is required. Check for everything, because देखें PID जो है ना is the overall ultimate thing. PID, pelvic inflammatory disease. It can be because of chlamydia, can be because of gonorrhea, can be because of other things. So you have to check for all the STIs, whichever is there, treat that. Okay, these include sequelae, and endometrial and fallopian tube inflammation can damage, and they have subfertility, ectopic. ये मैंने बात कर ली already आपसे, right? Laparoscopy in women with PID may reveal already scarring, because inflammation एक दफा होती है, जब वो heal करती है, there is fibrosis, right? So you may see scarring. So इसका ट्रीटमेंट डिपेंड करेगा कि डायग्नोसिस क्या है. इफ द डायग्नोसिस इज फॉर एग्जांपल गोनोरिया, ट्रीट एज इफ इट्स गोनोरिया. इफ इट्स chlamydia, treat as if it's chlamydia, right? These things. Sometimes you also have to do laparoscopy and you find strictures and fibrosis. You may want to tackle them, you may want to leave them depending upon how severe they are and what structures are involved. Now, viral sexually transmitted infections, they're very important. हम अभी HIV की भी बात करेंगे, herpes, these are common ones, okay? Genital herpes, there are two types of herpes viruses, herpes simplex virus, type 1 and type 2. Type 1 causes orolabial herpes. Orolabial herpes is often acquired in childhood, although it is also a common cause of genital herpes alongside HSV2. Remember, HSV1 ka portfolio and 2 ka portfolio are different, and they are both important. Following acquisition, the virus establishes latency in the local sensory ganglia, and it may be reactivated. People may see every season eruption of blisters around the oral area, for example, HSV1. Okay? This is all very important. Primary infection is the first infection with either HSV1 or 2, and then non-primary infection is the subsequent infection. Simple thing. The majority of initial infections are asymptomatic, although individuals may still be infectious. Recurrence rates are significantly higher with HSV2. All super important discussion. Symptoms include genital pain if it's genital herpes, dysuria. Examination, there may be multiple superficial tendal ulcers, blisters, regional lymphadenopathy, inguinal lymph nodes, for example. Diagnosis is by detection of viruses from these lesions. That's the definitive diagnosis. You do the PCR and you identify what it is, right? You can also do serology, take the blood, check for immunoglobulins, IgM, 2-HSV or HSV2. This is also routinely done, but diagnostic is PCR, identify viral material in the lesion. Okay. In clinical practice, this is useful when assessing women and their sexual partner in pregnancy. You check for HSV. This is very important. Fitzhugh-Curtis syndrome. This is like you see these fibrotic stuff. PID में ये देखते हैं आप, ठीक है? ये syndrome is associated with pelvic inflammatory disease. Okay. Now, neonatal herpes is devastating infection with a mortality of up to 30% and consequent lifelong neurological morbidity of 70%. 70% lifelong morbidity, mortality also very, very high. It is most often acquired during delivery. देखें, ये मैं हर वक्त कहता हूँ ना कि a pregnant female, if infected with such thing, can easily transmit to the baby, and that baby has the morbidity of 70%. Looks so high. Within the third trimester, and especially for the last 6 weeks, when reported neonatal infection rates as high as 41%. Oh my God, this is too high. Which means that you have to check and take care of herpes in female who are pregnant or intending to be pregnant. Immunoglobulin to the virus in serum crosses the placenta and provides neonatal protection from infection, but that is for some time period, because mommy's antibodies go away in about 4 to 6 weeks, right? For this reason, recommended mode of delivery for women with first acquisition of herpes in the third trimester is pre-labor cesarean section, so that the baby just simply does not pass through the vaginal canal and the cervical canal. Okay, so make a cut up in the abdominal or lower umbilical area, and then you take care of that. All right. Treatment of the symptoms of genital herpes is acyclovir, which is a viral drug, antiviral, and it is safe and effective, including during pregnancy. So it's an important point. Or a similar compound such as valacyclovir. These medications are often most effective and is given as soon as possible the symptoms develop. They suppress the viral load and they're pretty effective. Information for patients including lifelong nature of infection, asymptomatic shedding, risk to the sexual partner, risk of the transmission to the baby. You need to discuss these with the patient. Talking about genital warts, these are actually benign epithelial lesions. इनको tumors ही कहते हैं. they are caused by human papilloma virus. So अभी हमने जो virus discuss किया था, that was herpes simplex virus, and now we are talking about human papilloma virus. And there are so many genotypes. Herpes simplex में हमने 2 की बात की थी. There are also more there, but 1 and 2 are clinically relevant. But in human papilloma, there are more than 100 genotypes, and type 6 and 11, they cause over 90% of the genital warts. So these are associated with benign tumors, right? There are also high risk human papilloma viruses, which 16, 18, for example, and those are associated with cervical cancers. But warts के साथ जो association है, that is herpes human papilloma virus 6 and 11, these 2 genotypes. Okay, infection with HPV in the genital epithelium via sexual transmission is extremely common, and vast majority of the cases being subclinical. Infection with the oncogenic genotypes, which are 16 and 18, जिनकी अभी मैं बात कर रहा था, they are called high risk or oncogenic. They causes actually cancers, right? So 16 and 18 के against vaccines भी by the way available हैं. In fact, there are now quadrivalent vaccines जो कि they cover everything, 6, 11, 16, 18. So they're trying to cover 6 and 11, so they prevent against wart, and they're trying to cover 16 and 18, so they're trying to prevent cancer as well. Okay, and because of the vaccination, these infections and the symptoms have gone dramatically down. Diagnosis by clinical examination and treatment include ablative therapy, so you just remove them by ablation, liquid nitrogen के जरिए या surgical technique के जरिए. And when genital warts are present in pregnancy, treatment is limited to ablative options. You don't give any chemicals, obviously the female is pregnant. Rarely warts may become very large and obstruct the birth canal. This is a rare of the rare scenarios, but this can happen, and here you may need a C-section or surgical intervention. Okay. Syphilis is another condition which is called, it's a bacterial condition, not viral technically. It is caused by Treponema pallidum, which occurs through the direct contact with secretions from an infective lesion via transplacental passage. This is one cause, or during sexual intercourse, obviously. This infection is multi-system and therefore very serious, has many clinical features and may mimic other conditions. Untreated, it can relapse and remit and present with late complications. Infectivity declines with time, and treatment penicillin-based regime. So it used to be a problem, but now very much treatable. Those living in African and Asian countries and Eastern Europe are more often affected, and in the last 2 decades, there have been resurgence of infection observed in the homosexuals. It's a common epidemiological paragraph. The infection is classified as congenital or acquired. So congenital from the mom to the baby while passing through the birth canal, and acquired is obviously through the sexual activity. Okay. In acquired early syphilis, the initial manifestation is a chancre, which is the lesion which develops at the site of exposure. This is usually a single genital lesion, increasingly seen on the other side, such as oral cavity, but genital area is the first point of entry. Typically, the lesion is painless. This is very important because there are sometimes lesions in the genital area which are painful. They kind of exclude the diagnosis of syphilis. And इस lesion में से there can be exude serous fluid coming out, which also contain Treponema pallidum, so you can look that into the microscope as well. There is lymphadenopathy because this is an infection. This resolves within a few weeks, and following this, as the bacteria disseminate, a plethora of variable clinical symptoms may be present. It disseminates throughout the body, so fever and all those things, right? These include a widespread erythematous rash, typically including the palms and the soles, and alopecia, oral ulcers, genital mucus lesion, raised lesion. So there's so many problems, right? And condylomata lata, this is the big anogenital area lesion. Complications include neurological involvement, resulting in also meningitis. So now you just look at the spectrum of the organs which are involved in syphilis, okay? Eyes can also be involved, and this stage also spontaneously resolves sometimes, but obviously you have to treat, if you have to be well and devoid of complications. Late complications में जो 2-3 चीजें आपको पता होनी चाहिए. There is neurological involvement, cardiovascular, and there is skin lesions which are called gummus lesions or gummatous lesions, which are actually granulomatous inflammation, and they affect skin and bone primarily. Cardiovascular, they affect ascending aorta or aortic valve incompetence and insufficiency that can cause cardiovascular problem. Neurological, tabes dorsalis, progressive dementia, even general paresis if neurological systems are involved. So I would say these are very, very serious complications. So syphilis can lead to all these things, right? Congenital infection also consists of many symptoms and signs which are summarized in table 9.3. We'll have a look right now. And if you look at the congenital syphilis, early within 2 years, common manifestations include rhinitis, hemorrhagic rhinitis, nosebleeds, generalized lymphadenopathy, condylomata lata in the anorectal area, periostitis, bone problem, paralysis, nervous problem, mucus patches, perioral fissures, range of problems in the first 2 years of life, and a little late, more than 2 years. Then there are stigma of congenital infections such as keratitis, Clutton's joint, so bone problem, skin problem, sensory neural deafness, nervous system problem, hemoglobinopathies, neurological involvement, even cranial nerve palsies. Serious stuff. Syphilis is horrible. Now, the diagnosis of syphilis is usually by serology or directly detecting treponema pallidum. जैसे मैं पहले बता रहा था, lesion में से ये release होते हैं. You can check it actually. Also, you can do the PCR. Dark field microscopy में direct दिखते हैं and PCR testing से confirm हो जाएगा, right? Non-treponemal serology tests include rapid plasma reaction and venereal disease (VDRL), which demonstrate rising titers during active acute infection, but we don't usually perform this, particularly in the presence of more sophisticated, more sensitive, more specific techniques such as PCR. They may be negative in early infection. The VDRL test की बात हो रही है, इसके false negatives भी बहुत ज़्यादा high होते हैं. That's why we are very careful. There are other techniques available such as ELISA, CLIA pattern, immunoassays, or treponema pallidum particle heme agglutination assays. So these are also, so these are different tools which are available. I would just prefer, if this is available in the setup, the PCR thing. Okay. These treponemal tests may also be negative in the very early stage of the disease and should be repeated. So ये सारे इनके problems हैं ना इन tests के. Treatment is curative and involves depot preparations of penicillin. It's a penicillin-based treatment, but it has to be for the right time with the right dose. And then the disease just goes away. It is very, very curative. Simultaneous treatment of current sexual partners is also required because this is sexually transmitted disease. And when the time of infection is not known, tracing, testing previous other partners, and where applicable, children may also be required. So we actually go after those previous partners maybe weeks ago because there are late complications of syphilis. Maybe they have been infected with syphilis and now their nervous system is starting to be affected. Their cardiovascular system is starting to be affected. So you have to trace them, you have to check them, and maybe treat them. Okay. Now, I think this is the last of the discussion, HIV, human immune deficiency virus in this domain. And if we talk about HIV, the good news about HIV is that HIV used to be an absolutely fatal and nightmare sort of stuff, right? Now we treat it like we treat and manage hypertension and perhaps diabetes. So infection with HIV results in an initial acute viral illness followed by chronic decline. So अगर first infection हुआ है due to sexual activity or blood transfusion or whatever, so initially there's a spike in the viral count, then it goes down, affects the CD4 positive cells, and they go down. As a result of this, the patient becomes immunocompromised and AIDS symptoms start to appear. That's the kind of basic scenario that you know from pathology, right? So these are listed in table 9.4. We'll have a look. And importantly, gynecological practice के हवाले से include cervical cancer, cervical intraepithelial neoplasia. These are also very much related. So if you look at the AIDS defining illness, this is a big chart of a lot of different disorders which, if present, you should think about AIDS. Bacterial infection, repeated, multiple occurrent Candida, coccidioidomyces, crypto. These are all unusual type of things you don't usually see in healthy persons, you know. But if these are there, always think about AIDS patients. Cytomegalo, encephalopathy, HIV-related, herpes simplex, histoplasma, Kaposi sarcoma, different type of lymphomas, different type of pneumonias, all are AIDS defining illnesses, right? और फिर इसकी जब आप मेडिसिन के लेक्चर्स देखते हैं, then you come to know that there are specific CD4 count associations. So if CD4 count, for example, is less than 200, you see this much of disease. If it is less than 50, these are the organisms you see. But that's the whole picture. All these are AIDS defining illnesses. Okay? Right. In terms of treatment, if you talk about the highly active retroviral therapy, which is HART, has now transformed the lives of HIV positive people and their families, obviously, right? So this is very, very transformative, this treatment. For this reason, USA guidelines recommend offering HIV testing to all those aged between 13 to 64, and they should have access to medically and antiretroviral HART therapy if they are found to be HIV positive, okay? Because it has life-saving, family-changing implications. Gynecological complications in HIV positive women. When women with HIV infection are more likely to have infection with HPV 16 and 18. So HIV association with wart causing HPV. Okay. For this reason, annual cervical cytology is recommended in patients who are known HIV positives. With most guidelines recommending subsequent management in HIV negative women, it is worth noting that other anogenital malignancies resulting from oncogenic HPV may also be more frequent in HIV. So if you diagnose someone with HIV, anyways, you look for a lot of other comorbs, and one of the comorb to look for is the cervical cancer and cervical benign lesions. Okay. Now, contraception, this is the worldwide map for HIV patients, which area has the most HIV burden. And you can see the burdens in sub-Saharan Africa to be 1.4 million. That's in the millions. I mean, perhaps the biggest one, I would say. But these are the numbers if you want to go through all of them, right? Contraception and preconception management. So many antiretrovirals interact with hormonal contraceptives, yani combined oral contraceptive pills and progesterone only pill or estrogen only pills. These drugs, if the person is on HIV treatment, contraceptives may interact with each other, right? Resulting in reduced contraceptive efficacy. However, this is dependent on the combination of the specific medicines. With a holistic assessment is required assessing the patient. The dynamics of HIV drug interaction website from the University of Liverpool provides accurate information. So they are giving you a resource if you want to go and find out this in detail. Non-hormonal contraception such as condoms and IUDs are appropriate because they do not have any drugs or chemicals to interact with heart, and therefore these are routinely prescribed. Prior to attempting pregnancy, the health of HIV positive women as per partner should be optimized. This includes standard health promotion, and for serodiscordant couples, advice regarding prevention of HIV transmission. Because if the couple, the female has HIV positive, now they're trying to have baby, and the male, all the risk factor for transmission, for controlling the healthy person, the health of the patient, these are all part of discussions, right? So contraception with a condom can be used, and it is then a good contraceptive. But then if they want to become pregnant, what are the approaches? Okay, you have to consider all these as ethical practices. This is achieved by optimal HIV control in the patient, obviously, as transmission between sexual partners is extremely low when positive partner has undetectable HIV RNA. So patient को well treat करें so that the RNA goes below detectable limits, and now they can safely perform sexual activity and conceive the baby if they want. Okay. It is appropriate to offer fertility treatment when this is indicated to couples. So you remember the in vitro fertilization technique, so they can have a baby, they can conceive even without having intercourse. So that is an option, particularly where the viral load is not below the detectable limits, right? If the viral load is not being controlled appropriately, perhaps IVF or assisted technology is much more an option. Management of HIV positive mother and her child. So this is the HIV positive lady and her sexual activities with the partner. Now this is in context with the child. If the HIV positive lady is now pregnant, so all pregnant women must know their current HIV status. This is required if they are positive or negative. So this is part of the investigation you always do in pregnancies. And those who are positive require to require access to high quality medical and obstetric care, because they are HIV positive, they have a baby, you don't want to transmit the virus, right? Effective antiretroviral treatment ensuring undetectable viral load in the serum tumor. So you continuously treat the person, so and monitor via PCR what is the viral load. This is very, very important. Okay, most mother to child transmission, MTCT, what we call it, occurs during birth or breastfeeding. Intrauterine infection is unusual, and the risk of this is increased by an intervention that disrupts the placenta. Now, this is a very important point. So देखिए, if there is a lady who is now pregnant with she's also HIV positive, right, but now she's pregnant, so pregnancy itself is kind of not a risk factor for getting the virus from the mother. नेचर ने सिस्टम इतना प्यारा रखा ना यार, सारी लेयर्स एंड ऑल दीज थिंग्स, सो समहाउ ऑल्दो ब्लड आ रहा है प्लेसेंटा से, बट नेचुरली अगर ये प्रोसीड करती है विदाउट यू इंटरवेनिंग इन एनीथिंग, सो अगर फॉर एग्जांपल आप एमनियोसेंटेसिस करते हैं तो आप यहाँ से नीडल इंसर्ट करेंगे, प्लेसेंटा छेड़छाड़ होगी, नाउ द चांसेस ऑफ ट्रांसमिशन इंक्रीज। और कोई और अगर सर्जिकल प्रोसीजर है, यू वांट टू डू दैट, छेड़छाड़ हुई, तो दैट छेड़छाड़ कैन लीड टू इंक्रीज रिस्क ऑफ HIV ट्रांसमिशन। बट इफ द प्रेगनेंसी गोज विदाउट एनी छेड़छाड़ टाइप ऑफ थिंग, नेचुरली प्रोसीड कर रही है, तो ड्यूरिंग द प्रेगनेंसी इंट्रा यूट्राइन ट्रांसमिशन के रेट नहीं है, बहुत लो है। हाउएवर ड्यूरिंग द डिलीवरी, जब ये बर्थ कैनाल से पास ऑन, अगेन दिस इज द छेड़छाड़ ना, हलजुल है, हिलन जुलन है, तो दिस कैन लीड टू ट्रांसमिशन। सो दिस इज इंपॉर्टेंट टू अंडरस्टैंड कि मोस्ट ऑफ द रिस्क इज आइदर ड्यूरिंग द बर्थ, which is through the birth canal, or during the breastfeeding, not when the pregnancy is developing, okay, unless you do amniocentesis or some sort of chhedchhad, as I say. Delivery of the pre-labor cesarean section further reduces the MTCT. So you do birth canal se guzarne hi na dein, you do cesarean section, okay. Obstetric factors that increase the risk of transmission include prolonged rupture of the membrane, procedures that breach the infant's skin, कोई भी ऐसा प्रोसीजर स्किन का ब्रीच हो रहा है, बर्थ कैनाल से गुजर रहा है। सो ideal approach for handling a female who is pregnant and HIV positive would be number one, आप इसको ट्रीट ऐसे करें ना कि इसका एंटावायरल लोड थ्रू आउट द प्रेगनेंसी बहुत कम हो। नंबर टू, अननेसेसरी प्रोसीजर्स ना करें। नंबर थ्री, आप टर्म डेवलप होने का वेट ना करें जिसमें रप्चर्स हो मेम्ब्रेन और ये सब चीज़ें। आप एक smart decision लें, slightly before the rupture of membrane you do the C-section. So if you follow these techniques, you are preventing the transmission of HIV from mommy to the baby, okay. Even in the presence of well-controlled HIV, transmission rates to infant during the breastfeeding are up to 3%. जितना भी control कर लें, कुछ chances तो रहेंगे ही ना, but that's the best you can do, control, okay. Knowledge of these modern tests, management of SIT, they are all very important. So this was a super important chapter to me because it has very important clinical implications. Now let's go through a few questions और फिर इस chapter को wrap up करते हैं. Which of the following infection can be diagnosed on wet mount microscopy? Choose a single best answer. Gonorrhea is for which we do the wet mount. So it's a straightforward one. And what do we have here? A 32-year-old woman presents at the community reproductive clinic with altered vaginal discharge and mild abdominal pain. On examination, there is a profuse mucopurulent discharge from the inflamed cervix. All the clinical symptoms are there. What is the appropriate management? Choose a single best answer. So, what do you think it is? This can be, you have to go through these symptoms. You have to think the age of the patient, sexually active है, reproductive age है, reproductive clinic में आई हैं with vaginal discharge. So, what do you think it is pointing towards? Gonorrhea? Chlamydia? Let's just do the NAT testing and the culture and sensitivity and test for other STIs. That's the best approach so that you identify which organism is it and how to approach and treat the patient, right? Now, here is a case and they will ask you a few questions. Let's go through the case. This 29-year-old woman presents to the emergency clinic, gynecology clinic, the 5-day history of lower abdominal pain and pelvic pain. So there is pain, okay? Got progressively worse over the last 24 hours. She also feels generally unwell, chills and rigors, fever है, infection. She has had several partners in the recent month. कहीं PID तो नहीं develop हो रहा इस patient को. She is not sure whether she completed the whole course of antibiotics for chlamydia or not. She does not use any form of contraception. Another risk factor, unprotected sex हो रहा है, no condoms. On examination, she looks unwell. She has raised temperature. So PID की तरफ बात जा रही है कि नहीं जा रही? देखें, all these things are pointing towards PID. On pelvic examination, there is marked cervical tenderness. All PID. So what is the diagnosis? I will have the diagnosis of PID straight away. What test would you like to do? कई सारे. I would like to see vulvovaginal examination में मैं swabs लूँगा. I would do wet mounts. I would do all sort of investigation जो हमने discuss की है. And how would you manage? Whatever the cause. PID is not itself a thing जिसको आप बोले मैं treat कर. You need to identify the cause. Is it because of gonorrhea? Is it because of chlamydia? Is it because of something else? Identify the cause and then treat accordingly. So there will be a generalized treatment जो PID के symptoms को control करेगा. जैसे आपने fever control करना है, systemic symptoms control करने हैं, अगर कोई coagulopathy develop हो रही है तो वो control करनी है. And then you need to identify the cause. Absolutely nip this into the bud. Okay, so that's all about this chapter, and chapter number 10 is the next, which is urogynecology. So all the very best till I see you next.